Hello, everyone. I'm Nita Ray Chaudhuri, an attending pediatric cardiologist, director of the Advanced Imaging program at WVU Medicine Children's Hospital, and assistant professor of pediatrics at West Virginia University. I'm a social media ambassador for the Society of Cardiovascular Magnetic Resonance, SCMR, and the virtual SCMR scientific sessions, which are being held from February 18th to 20th this year. As a pediatric and congenital cardiac MRI imager, I'm really proud to say that we've come a long way since the first pediatric cardiac MRI was performed. As the field of pediatric and congenital cardiac MRI continues to advance and becomes the forefront of non invasive imaging, and we most often see that this is a one stop shop nowadays, I'm absolutely excited to be joined by Dr. Rahul Rathod, who has been a pioneer in this field and also my trainer and mentor in cardiac MRI. Dr. Rathod, who needs no introduction, is a pediatric cardiologist and director of the single ventricle program at Boston Children's Hospital. He is an associate professor at Harvard Medical School. His clinical and academic work has been in the application of cardiac MRI for risk stratification in patients with single ventricle heart disease. And finally, Dr. Rathod is also the chair of the pediatric congenital heart disease section within SCMR. Thank you very much for joining me today, Dr. Rathod.
Thanks, Nita. Again, just call me Rahul, but it's great to get a chance to talk to you.
Great. So, Dr. Rathod, at this year's conference, you're giving us a talk about outcome prediction using cardiac MRI in Fontan patients. From your session, what will be the most important take home points for us?
So, over the last several years, there's been a lot of great work that has proven that CMR is an important long-term risk stratification tool in patients after the Fontan operation. In fact, I actually think there's a lot of data that suggests that CMR may be our best tool for risk stratification, especially when we're looking at the non-invasive modalities. In the talk, I'll share these data and hope to convince everyone that CMR should be part of the routine assessment in this very vulnerable population. Unfortunately, too many of these patients have died prematurely, and there's increased comorbidities as they age. And I think CMR can help separate those who are going to do well and those who may need our help and need an early intervention.
That is amazing to know. Thank you for those very useful points from your talk. I do have a few more questions. So, for my next question, I was wondering about what the next steps are for you and the field in regards to cardiac MRI and the single ventricle patient.
That's a great, very timely and a super exciting question. So much of the work about CMR imaging in single ventricle patients has been part of a single center effort. And that's created a lot of learning to date. But at the end of the day, we're all just holding one piece of the puzzle. We have to do better, we can do better, and we can do better if we do it together. So that means that we, as a community, have to come together and share our data. And so for the last several years, we've been putting together an initiative we call FORCE. FORCE stands for Fontan Outcome Registry using CMR examinations. This is going to be an international Fontan CMR registry that will dramatically accelerate learning and discovery. We're cloud storing all the data, including the CMR image data, so it'll be a powerful resource for all of us to share. We're going to apply advanced data analytics and machine learning to take this to the next level. And I'm proud to say that we've officially launched the registry back in October of 2020 with 9 institutions. And now we're looking to enroll new hospitals. So if you or anyone out there is interested, please contact me. I hope to have at least 50 institutions up and running over the next couple of years.
Wonderful. That all sounds very exciting. Be sure that we're definitely going to be reaching out to you to add our patients and be a part of that registry as well. So, for being a pioneer in the field, what would be your best advice for either the early clinician, researcher, or trainee in the practice of cardiac MRI?
I've always thought of CMR as a team sport. So that means it's really hard to do or go at it alone. It's important to be able to phone a friend, share images, and to kind of get that instant second opinion. We need to make the activation energy for that as low as possible. And again, the reason for that is that multiple sets of eyes on a challenging case are always better. That dialogue we have with each other helps us all think about how we do things better. And so if you're part of a large group, this is obviously easier to do. But if you're not, I would encourage you to reach out to your other family. All of us are part of this great PEDS congenital heart disease section. And within the section, there are lots of people out there who are always willing to lend a hand or lend another pair of eyeballs. And we even have a dedicated early career subcommittee who is basically connecting, mentors to mentees, both for clinical work, but also program quality improvement and even academic work as well.
Wonderful. You pretty much answered my next question, which was going to, ask you about what your advice was for getting more involved with the SCMR, especially the pediatric congenital section of SCMR. Maybe can you talk about the various subcommittees that are, there within that section? And that I think will be helpful for all of us and our audience as well.
Well, I'll step back 1 second to say that I'm really proud of our PEDS congenital heart disease section within SCMR. We've had some great leadership by Mark Fogel, Andy Powell, and Adam Dorfman, and we've built a vibrant and engaged section with over 600 members. We're scattered across the globe. We have people of all radiologists, cardiologists, technicians, really, lots of different excellent people to work with. And we've created 8 subcommittees within our section alone. Topics that range from machine learning to quality improvement, to education, to even interactions with industry. Nice. Each subcommittee is an additional opportunity to engage in SCMR, and not just at the scientific sessions, which we all love to do, but through these subcommittees, you can actually be part of SCMR all year long. And these groups are actually accomplishing amazing things, which is really exciting to see. We've also made it so that the leadership roles in these subcommittees and also the leadership roles within the PEDS Congenital Heart Disease Steering Committee, they're all limited to 3 years. So that fosters renewal of new energy and creates opportunities for new people to engage and help be part of SCMR.
Wonderful. That just sounds very exciting. Looking forward, to everyone listening to this and, just knowing more about these subcommittees and just getting more involved in general. So Dr. Rathod, thank you very much for all the advice and joining me today. It was a great honor and absolute pleasure talking to you, and in the process, learning more about all the great work that you've been doing in this field, especially with single ventricle patients and the use of cardiac MRI in that population. Thank you for joining me again.
No, thanks, Nita, for talking with me. I've really enjoyed it. I'm looking forward to the virtual scientific sessions this year. I'm looking forward to connecting with old friends, meeting new ones, and kind of engaging within all the excellent content and hopefully learning a bunch of new stuff that I can bring home.
Yes,
thanks again for spending the time.
Yeah, I'm really excited as well. I mean, this is the first year that we're going to have a virtual platform, so with a lot of exciting sessions. So thank you very much again. Bye.
Bye. Thank you again.